Hey everyone, what's up? It's Dr. Charlie, physical therapist here, and in this video I want to talk about a couple simple exercises or movement strategies that you can use if you're just getting over a flare-up, if you have some type of back, butt, or sciatica pain. So a lot of times if you're in a flare-up, it scares the heck out of you, right? You start to panic, you start to freak out, and you become more fearful of movement. So how can you get moving again in a way that feels safe and is also effective in not only reducing your symptoms or potentially reducing your symptoms, but not making things more flared up? For those of you who do not know me, my name is Dr. Charlie Johnson. I'm a physical therapist. I have my orthopedic board specialty, and I help people all over the world with unresolved back, butt, and sciatica problems learn to essentially fix themselves so that they don't have to rely on other people by teaching them how to use the power of the mind and movement as medicine. And if you're having a flare-up and you're not exactly sure as to what is flaring up, maybe it's your back, maybe it's your butt, maybe it's something else, then go ahead, download my DIY diagnostic guide. I would recommend you grab a free copy. Inside, I outline all the exact movement experiments, self-tests, and things like that needed to figure out the most likely source of your symptoms. Prepare to be amazed for the stick figure of the century. Ta-da! All right, really bad drawing, but here's what I want to explain. So if you're in a flare-up, all right, let's just say that you have some type of pain in your butt cheek and it's going down your leg and it's flared up, it's gotten worse, you're having a setback. You could approach this a few ways. So the way that most people would approach it is like this. They would start doing stretches and, oh, it hurts, so they'd start digging their thumb into their butt cheek. They'd think that they need to schedule a few more sessions with their massage therapist or their acupuncturist or their chiropractor or go to PT. Maybe they've been slacking on the foam roller, so they pick that up again. You can do that if you want, but I think it's a bad idea. So let me explain why. So instead of this being a stick figure, all right, a human form, all right, let's just pretend that you're in a helicopter right now and you're looking down on an island, all right? So this is the outline of the island, all right? The water's out there, right? And this red spot that you see, the pain that you're experiencing, hopefully you get this analogy, is a fire on the island, a flare-up, all right? Flames. Now, you want to tour this island, and so imagine, right, that I'm on the island, and let's just say I have a few kids, or maybe I have a dog with me. Would you want to, you have all this place that you could explore and still have fun, you have this little fire on the island. Would it be a great idea to go explore right around the fire? Meaning, would you tell your dog, or maybe your dog listens that well, I don't know, or would you tell your kids, hey, you know what, there's a fire going on right there, and we have all this area that we could explore, but why don't you just go run around the fire? You wouldn't do that, right? That would be a bad idea. That's one way to get burned, right? And so at the end of the day, most people, even though they don't like playing with fire in real life, they're happy and think it's the best way to reduce their symptoms to play with fire in their body, fire being the pain. So if you have pain signals in your butt, right, and you've got all this real estate, your entire body, your brain and your body are just saying, hey, like that area's off limits. But what's the first thing everyone wants to do? They want to try to apply creams and rub and massage and stretch and do all these things to the area of pain. You're literally playing with fire. Maybe not fire, but you're playing with a flare-up. All right, and so if you want to think of it like that, and that analogy helps you, and you recognize that, yeah, that wouldn't make any sense. If I had all this land and I could do anything I wanted and there was a fire over there, why would I go run around that fire? Why would I go tell my kids to play around the fire pit? You could, but why wouldn't you do it somewhere else? And so the idea I'm trying to get at is that most people focus on that which they can't do. The fire is just so engaging, right? It's like this, there's no excitement going on anywhere else in the land, right? But the fire is something maybe that, you're focused on. And so when you have pain, you tend to focus on that which you can't do and that which you can't, that which you don't like, that which you don't want. The area of pain in your back or your butt or your leg. And you try to fix it, because why wouldn't you? Think back to when you were in first grade. Heard this from one of my great mentors who brought it up, and this is really game changing if you can wrap your head around it. Same thing applies to pain. When you grow up and you take a test, what does the test look like when you get it back? Are all the right answers circled in green? No, it doesn't happen like that, right? Instead, the test is marked up with lines and squiggles and circles and X's in red of all the things that you got wrong. And so it's no wonder that we're used to focusing on that which doesn't work well, didn't go right, is wrong, whatever, all right? And we try to fix those things because that wasn't right. But if we try to fix that which is painful when we have a flare-up in the body, we can often make things worse. So that is the highest risk area. If you have a flare-up or you have some type of pain in the body, the area of pain is the highest risk area, the most threatening area that you could potentially start to work in or about. So if you have a flare-up, take it from me as somebody who works with thousands of people with these problems, do not start trying to poke, prod, or exercise that area. That is off limits, all right? It is unsafe to your nervous system and probably to your body if you have a structural cause of your pain. So then what do? Well, what if instead of all the things that were wrong, marked with X's and reds and all that, what if all of the things that were right were the focus or became the focus? And so you have all this land. We're back on the island now, all right? And you want to think about in your body. You have all this land. It's all connected. Instead of focusing on that which doesn't work, focus on all of that which does work. Focus on what you can move. Focus on what you can do. All right? And so if the left side of your butt and your leg hurts to stretch, could you start working the right side? If the lower back and below is off limits, maybe both legs hurt, and you just don't feel confident doing that because it's still too close to the fire. You can still feel the heat, right? Then why not move the trunk? If you're like, I can't move anything. Every time I go to PT, Charlie, it flares me up. It does so because they're treating right in the area of the fire. They're blowing on the fire, all right? And so they're contributing to the flare-up because they're messing with things that are hot and bothered and painful. And they're increasing the sensitivity. They're setting off bells and whistles within the nervous system. Charlie, I can't do my lower body. It's painful. I don't know how you can help me. Well, you've got a trunk. Oh, and guess what? You've got a right arm and you've got a left arm. And so I wanted to start with this because what I'm about to show you, 2 or 3 things here, might make you wonder and or question like, why the heck are we doing this? And how does this make sense? And so this is the concept, all right? Because I'm going to show you some things that are sort of outside the box or outside the immediate area of injury. If you're in pain, you have a flare-up, do not treat in the area of injury, number 1. You could, but it's the highest risk. So most people without an untrained professional, right, will not be able to do that safely. Treat outside of the area of injury and find something that feels good and feels safe and just start moving your body. Resolving your pain is so much more than just the mechanics of the joints and discs and things like that. What happens, and I said this early in the intro, I think, of the video, is that when you hurt, you start to become less confident. That's a brain construct, confidence. You become more fearful, brain construct, emotion, feeling, of moving, body construct. And so you hurt, you become more fearful of movement or worried or concerned or a little gun shy. You move less, you become less confident, brain, you move less, brain, body, brain, body, brain, body. We're not just treating the body here. We are treating the brain first, body second. So you've got to get your nervous system to feel safe. So how is it that moving the trunk, moving the arms, moving the legs, as you'll see here in a moment, might be valuable? Well, you can start to teach your brain that movement doesn't have to equal pain. And when you do that, not only do you teach your brain that it can be confident and safe with movement, movement doesn't have to hurt. PT doesn't have to hurt. Exercise for this problem doesn't have to hurt. But you also show your body that it can move, and you start to build confidence. And when you start to build confidence, you shift your overall perception, mood, and mindset as it relates to motion, and you start to free things up. Your arm is not outside of the body that your butt is, right, or that your leg is. So your arm and your leg are part of the same body is what I'm trying to say. They're all just different gears, if you will, inside the system. And if this one's jammed, because that's where you hurt, sometimes you got to move something else so that you can desensitize the brain. You can get yourself moving in the positive direction by focusing on what you can do and what feels good versus always trying to fix that which isn't working. Massive nugget. Let me show you 2 or 3 things. Hopefully that wasn't too long, but I repeat myself because this is a major shift for people. It's a major shift for people in pain. People in pain think, this is where it hurts, I've got to treat this. This is where everybody's poking things. This is where everybody's looking. This is where the chiropractor is trying to say, this is your problem. This is where everybody is looking for problems and trying to justify why you hurt. And then when it comes to solutions, this is where everybody's aiming all the shots and the massage and all of that. But that is the highest risk area because that is where you're flared up. That's where that the analogy of the fire, if you will, in the butt cheek or whatever, the fire on the land. Don't play around that. You're likely to get burnt. Instead, let's look outside of it. And by doing so, the whole stinking thing is connected. It's possible you can move your arm. It's possible you can move your trunk and influence something in your legs because you can't disconnect them. All right? They're all in the same bubble. They're all in the same system. So if you apply a systems theory and you think outside the box, you can start to find more comfort and you won't just keep going to different places, getting treatment, and continue to flare yourself up. All right, so here are 2 or 3 things. I'm going there now. All right, just hang in there. I'm going there now. And we're going to show you some different exercises that you can do to get back safely into moving if you're flared up or you're having more pain for whatever reason, okay? All right, so here we are. So model patient, aka wife Heather. Things are all flared up. So let's just say she's got a lot of pain, like in that beautiful stick figure drawing, in her left butt cheek and down her leg, and for whatever reason she's having this flare up and or setback. I want to show you 3 simple things you can potentially try. Now just know that these are general recommendations, so if any time any of these things bother you or don't feel safe, then just don't do them, all right? And I want to show you them in order of sort of most aggressive, closest to the fire, and then we're going to go least aggressive, most safe. There's a spectrum here in case you can't tolerate one or the other. Okay, so first things first, she's got pain in her left butt cheek, down her leg, and it's angry. So normally what would happen is what? What would most people do if they have a pain in the left butt cheek?
Probably try and stretch it or massage it.
Okay, great. So you would be doing this all day at work, right? You'd be laying on the ground, you'd be doing this and pushing it and pulling it and all kinds of funky stuff. Don't do that. This is where it hurts, all right, on that side. So it's a highest risk activity. What you could do, though, is you said, all right, when I pull on that butt cheek, if it bothers me or it hurts so good in the moment, hurts so good, it still hurts, all right? So that hurts. It's yucky. Do the same thing on the other side. So what you could do is you could take the same leg, perfect, and do some type of stretch. You could either bend forward into it if you wanted, whatever. It's got to feel good, but you want to find some way to maybe take a painful motion that is on, in this case, your painful side, and ask yourself, can I do the same motion on the other side? All right, we talked a little bit about how this can influence the pain potentially, but here's the thing. It's getting you moving, and it's keeping you, it's doing 2 things. It's keeping you from stretching that, so it's keeping you busy. I'm doing something. Everybody in pain loves to feel like they're doing something to solve their problem, but it's also just getting the body moving in a way that is non-threatening, all right? So I would say, hey, and it could be any motion. Here's the thing. It could be lots of things, but a very classic thing would be that you would maybe try a figure 4 stretch if you feel in pain, because that's what you're told to do, or that's what you'll look up and they'll tell you to do on YouTube. Do that same motion on the good leg. And you can do it lying down, you can do it seated, there's lots of ways you can do it. And here's the thing, you can do any of what I'm going to show you, and you can either do holds or repetitions of it. So if you were to do this, you can kind of bend forward, and you could hold maybe 3 times 30 seconds. There's no science behind the hold times, all right? Just do an amount that's comfortable. And or you could do reps. So you go down, feel a little stretch, and come off. You could kind of pulse, if you will, into that, all right? And so that's the first thing you could do. But recognize, you're still moving the hips, you're still moving the back a lot, all right? So that might be too threatening for you. If you do it one time and it's yucky, it's off limits, all right? So let that down. The second thing you could try that's a little bit less aggressive and a little bit safer and a little bit kind of more away from the fire or the flare-up is to work on a trunk twist. So scooch a little bit to the edge of the chair. And what you would do is put your hands wherever you want. She puts them on her belly. I don't care if you put them on your head. I don't care if you want to do the Macarena. It doesn't matter to me, all right? It's not important. Now, I don't care if you sit up tall or you slouch. Pick the one that feels best. Are you getting what I'm going for here, all right? Then what I would ask you do is that you twist whichever way you want, but if it's the left side, maybe we'll say, okay, just twist to the right to start. So twist gently to the right. Cool, and you look like stressed out when you're doing that. Are you stressed out?
No.
All right. You're doing it like very nice job. Just do it in a way that's comfortable.
Okay.
All right. All right. And so she might want to put her arms here. Just relax. There you go. And stay twisted. All right. Cool. And so she would ask herself, how does that feel? Does it feel safe?
Yes.
Okay, good. Now twist to the left. Or test right and left sides. All right. Safe?
Yes.
Good. Okay, so they're both safe. If one was not safe, let's just say she twisted left and she was like, oh, yucky, don't do that. All right? So she would twist to the right, and she could simply perform holds. So she could just hold herself in that position, say 3 times 30 seconds or something like that, into the good direction. It feels safe, it feels good, it's getting her moving, it's making her feel more confident, and heck, while she's doing this, she can't be stretching her painful leg, so I love that too. All right? And so she could work those holds in throughout her day to start to break this movement-pain relationship. Oh, I can do something. Movement isn't bad. All right? There's key psychologically to that. All right? And let's just say, though, that both trunk twists are yucky and the leg's yucky, and you're like, dude, see, I can't do anything. No, you still got a head and you still got arms, I think, or hopefully. If you don't, I'm sorry. All right? So what you want to do is you want to take your arm. I'm going to show you just one direction. It doesn't matter. You could do other directions. You could move your arm back. You can move your arm forward. You can move your arm, do arm raises out to the side, right? Really doesn't matter. So just know you can be a little creative with this. But let's just say arm forward. So raise it up as high as you can. I don't care, again, if she sits up tall or whatever. Do whatever is most comfy. Go ahead and raise the other arm up. Right? And you want to ask yourself, do they both feel safe or do they feel painful? Sometimes you will notice that when you raise an arm, if you raise the right arm, it activates the left side of the lower back, little tip there. So it is possible you could raise your arm and cause more pain in your back or your butt. It's not weird per se. So are both of those yummy, feel good, or do they feel threatening?
They were yummy.
Good. So she got 2 yummy arms. So every time I go to PT, I get worse. How can you help? We can't do any exercise. You can. You can focus on what you can do, everything that's green. But everyone wants to focus on what they can't do. So what you can do is you can say, great, they both feel yummy. Which one would you rather do? If you had to do like 1,000 of them, which one's yummiest? Which would you prefer?
The left arm.
Great. I have no idea why, nor do I care. She loves the left arm. Great. So what she's going to do is she's going to do a bunch of either raises or she's going to do a hold. She's going to get up there and just hold it. She could have done reps, by the way, with the twist. So just to go back, she could have done a bunch of twists to the right repetition-wise, all right? And so that's a start. And I know maybe that seems a little funky, but I took some time to explain the theory prior. So you want to think about what you can do versus that what you can't do. You want to think about what feels safe and non-threatening, and oftentimes treating in the area of injury using a very traditional approach will often make you feel worse. It doesn't mean that that can't help you. It just means that most people, if they want to get better, will not respond to doing things that make them feel worse to get better. All right, like if you want a yummy smoothie, you don't just throw like a bunch. The more yucky ingredients, the more like moldy strawberries you throw in there, it doesn't just automatically at some point get better. All right, so it's not that pushing into symptoms never works. It's just that for most people, again, without supervision or without further understanding, going into pain, playing around the fire will actually increase their symptoms. So if you're having a setback, you're right, the traditional things might be off the table, but you can still use, you've got a good leg, you've got a good trunk. There's a lot of different movements even within these, so this doesn't help. That's okay. Find the yummiest of all these things and see what happens. All right, and when I say see what happens, there's sort of another layer to this to see if the way that you move actually improves kind of that which is painful or yucky, but probably more for another video. So hopefully that's helpful as just an entry point to begin exercising again if you feel a flare-up and or some type of increase in symptoms. And again, it doesn't have to look like this. It could be anything that feels good. Focus on what you can do, not what you can't. That's all I got. Leave a thought in the comments. Also, hit the like button, hit the subscribe button, as well as the bell for notifications when I post new videos every single week. Thanks.